Okay, as you open my classes, you will see that I have 380 and my small group. I made assignment here, said respiratory soap node. And I want to add a case to this one so student can go over the case, decide how to write their soap notes. So this is, I find my cases. And the case library has many cases already pre-populated here. And if you want to do critical care, you have arts, closed head injury, drug overdose, shock, liver failure. And if you want to do simple patient like this, they have fundamentals, how to administer oxygen by nasal cannula. And those are the National Need of Nursing ACE project, and then you have a COPD exacerbation, and then you have a maternity, they have med surge. And the case I added to is the case has COPD, spontaneous pneumothorax. So you add this patient to your case, to your my own case library. So now I have this case in my own library as you click the add sign. And then you go to the case. You want a student to work on this one, you want to make sure that you have all the information they needed. So the case here, you said, I want to see what exactly is inside. So here is all the demographic information. And I'm going to focus just on the notes. When you do the assessment, the S come from HPI, history of a present illness. So I am going to go to the HP here. And here said, this is all the content here. This is really not a history of history and physical. It's more HPI here. So Mr. Brody has a past medical history of a COPD exacerbation, secondary to 100 pack a year of smoking, 2 pack a day times 50 years. He continues to smoke despite numerous attempts to quit smoking. He presents to the hospital with a COPD exacerbation due to increased inability to perform daily activities, nocturnal dyspnea, and increased sputum production. He did not describe the sputum color and the amount. Upon physical exam, Mr. Brody is alert-oriented times 3. This part is definitely O. Appears shortness of breath, hunched over in respiratory distress, and positive use of accessory muscles, bare chest, digital clubbing present, and distant dyspneic. Okay, then you go to assessment here, and you want to add your own assessment. So the neurological assessment is by default is the first one. So I'm going to just check oriented times 3. And my focus is on respiratory. I'm going to move on to respiratory. So each time you document, you can add your name into the system. So it will always there. By click on it, and you add yourself as a new provider first time and put a registered nurse or whatever you want to put it here. And then you I put day 1 after the admission, and the patient was on oxygen. Do I see the oxygen here? I do not. Okay, nasal cannula and 2 liters per minute. Sputum color, because it was really never mentioned here. And let's say patient said was whitish, creamy color. You don't make it up, of course, but if they said that, and say it's a moderate amount of sputum, this kind of information, 8 characteristics, we should connect the information on that. And cough, shortness of breath, difficulty breathing with activity, and the use of accessory muscle, and if there's others, you can add into the others here. And the breathing, let's put a lower, right lower lobe is the one affected the most. So right lower lobe right here is clicked. I wish there's a place that you can also have a bilateral. Let's say it's expiratory, wheezing, scattered crackles, decreased breathing, that posterior hurt the most, things like that. You can then you need to check the different one. When you check different one, it will be select a different region. And you can put it like if it's a clear diminished in this area, then you put that. Respiratory labored right here and other nodes. I already know that there's no other place you can find the barrel chest, so I'm going to put a barrel chest here and the digital clubbing here. So I don't think there's other we need to add to it. The rest we already checked. So then you go to different system. As I said, if you want to see barrel chest, it's here. The barrel chest is not here. And the clubbing, it should be in skin and nail. It's not here either. So that's why I documented that one. Just for your information, then we put a vital signs, and then a vital signs here. Clearly you see a dramatic change in respiration from 20 to 24 to 30, tachypnea and the tachycardia. So there was something going on. For this case, it's building up on as a pneumothorax from bronchitis, emphysema. So then if you want to see, they actually have x-ray here. The CBC here basically has a normal WBC. So it's not inflammatory at this time. It's not acute infection. However, if you see diagnostic, if you put other diagnostic here, you have two chest x-ray. One is the early on one has no tachypnea, and at that time it was just old COPD and emphysema. And if you go to the second one, and this is the 8 o'clock one, the one associated with the tachypnea and the tachycardia, patient's condition deteriorated, then that's the time I had pneumonia. Oh, I had a pneumothorax. Sorry about that. And the notes here, we're going to just ask the students to write a soap notes here. So you again, you put your name in and one day. And you can put it as a shift nurse, and you put as O A and P. So this is what you want your students to write here. So in S, they can put shortness of breath, dyspnea, cough, no fever. The objective, you can put a neuro-oriented another times another oriented times 3, but the respiratory you can put left lower lobe, wheezing, expiratory, wheezing, scattered crackles, increased using of accessory muscles and Disney clubbing, finger clubbing, all those you can put it right here. And then you put a GI, you can put a GI, GU, whatever, but those are all negative at this time. Assessment, you will put like a COPD with acute exacerbation, and you can put cough, and you can put um, um, hypoxia, and then plan, you can put um, oxygen therapy to maintain O2 grade saturation greater than 90%, IS, deep breathing, and you can put bronchodilator, maybe steroid treatment, then they will wash their mouth after the inhaler use. All those nursing care management, they should address them here. Now, after they complete, I'm just giving you an example here, then you do a sign. You see here, it will come to the bottom, basically have your soap notes there, and that's your student soap notes. You can grade it based on that, and that's it.